Dear students, welcome back. In this session, we are going to see the general features and the introduction of temporomandibular joint. In our body, we are having so many joints which are used in locomotion, and some other joints are immovable joints which helps in stability and protection of some of the internal organs. Okay, this temporomandibular joint is a movable joint, but when we compare with the other joints which are present in our body, this temporomandibular joint is unique in the body, both in structure as well as in function. Okay, the mandible is a horseshoe shaped bone. The mandible is a horseshoe shaped bone that has an articulation with the temporal bone at each end, forming two completely separate joints, but they are interdependent to each other in performing motions of mandible. So here the temporomandibular joint is formed by the horseshoe shaped bone that has an articulation with the temporal bone at each end of the mandible, forming two completely separate joints at two ends, but though they are separate joints, but they are interdependent to each other. In performing motions of mandible. That means only one joint is not moving. So both the joints will move together to get a desirable motion of the mandible. Okay, in addition to these two separate joints, each temporomandibular joint has a disc. Each temporomandibular joint has a disc. This disc separates this one temporomandibular joint into two joints, an upper joint as well as the lower joint. That means when we consider these two joints, totally how many joints are formed? 4 joints are formed. So all these 4 distinct joints are involved with any motion which occurs by the mandible. Okay, that means if you consider the mandibular movements, all the 4 distinct joints are involved with any motion which are occurred by the mandible. Okay, that means what are the movements? That means opening of mouth, closing of mouth, protrusion, retrusion, and as well as the lateral deviation, like that. For all these movements, these 4 joints, that means at each side two joints are present in a single temporomandibular joint. So all these 4 distinct joints are involved in the mandibular movements. So with all these factors, resulting this temporomandibular joint is a complex structure, results in a complex structure. And also the movements which are taking place by the mandible at the temporomandibular joint will occur in all the planes, that means sagittal plane. In sagittal plane some movements are taking place, in coronal plane some movements are taking place, and in transverse plane some movements are taking place. But in all the planes the motions of the mandible occurs at this joint to achieve normal function, okay. So this joint not only structurally unique but also functionally this joint is unique. The movements taking place at the temporomandibular joint or the mandibular movements, that is closing, opening, protrusion, retrusion, and lateral deviation. So in addition to these motions, some of the motions like eating or chewing, which can create greater stress within the joint, and also at the time of speaking and swallowing, for such kind of movement, for such kind of functions like speaking and swallowing requires temporomandibular joint motion that is to be finely controlled and requires little force, so that means this temporomandibular joint is also exhibiting a complex function. That means sometimes this joint withstands greater stress like in chewing and eating, okay. Whereas in the case of speaking and swallowing, so this temporomandibular joint is moving in such a way that it is finely controlled and requires little force for speaking and swallowing. This two things shows that this temporomandibular joint is also functionally unique. So the temporomandibular joint is unique in the body both in structure and in function, okay. And this chapter will introduce the temporomandibular joint structure as well as the function of the temporomandibular joint. By knowing the structure and function of this temporomandibular joint, you people can appreciate and understand its unique features, and also you can understand the relationship between the temporomandibular joint and the cervical spine, and you people can understand the impact and the impairments and also the pathologies related to the temporomandibular joint. And this chapter also introduce some of the common problems that involve deviations of normal functions of the temporomandibular joint, okay. And also this temporomandibular joint, coming to the structure once again, this temporomandibular joint is formed by the condyle of mandible and the articular eminence, here you can see the articular eminence of the temporal bone and also the articular disc that is interposed between the two. That means an articular disc which is present inside the joint. All these three involved in the formation as well as the articulation of the joint. So here you people know that in between a disc is present, isn't it? So this is an articular eminence, and below this you will have the condyle. So in between articular disc is present. So the upper joint which is formed by the superior surface of the articular disc with that of the articular eminence, that kind of joint formed here is the gliding joint, and the joint formed below the articular disc, that is the inferior surface of the disc with that of the condyle of the mandible, forms an hinge variety of joint. So here we are getting two kinds of joints. One is gliding, and upper joint is called gliding joint, and the lower joint is called as hinge joint. So, and also the another thing in relation to the structure is, so it is a synovial joint, isn't it? So normally the articular surfaces are covered by hyaline cartilages in the synovial joint. But in the case of temporomandibular joint, so these articular surfaces are covered by some dense collagenous tissue which have only some chondroblasts. So such kind of tissue is called as fibrocartilage. So these articular surfaces are covered by what? Fibrocartilages. So this kind of synovial joint is called as atypical synovial joint. This joint is called as atypical synovial joint. Because of the presence of articular disc, this temporomandibular joint is also called as bicondylar type of joint. Bicondylar type of joint. So that thing you can understand when we deal with the articular disc separately. You can understand how this is called as a bicondylar joint. So finally, with all these factors, we have to conclude this as this temporomandibular joint is a unique joint in the body because of its complexity in structure and in its function. Okay. So in the next video, we are going to see the articular surfaces of the temporomandibular joint. Thank you.